Hi, my name is Garrett, and I will be your nurse today. Today we will be performing your head-to-toe assessment. Can you please give me your name and date of birth?
Virginia Hogan, September 15th, 1989.
Okay, can you tell me what the date is?
April 13th, 2020.
Okay, do you know where you are and why you are here?
I'm in my house for my head-to-toe assessment.
Okay, perfect. Have you had any change in mood or depression?
No.
Do you have any history with any neurological disorders or
No.
symptoms? Okay, great. So first we'll start with your head. Have you had any recent head injury or trauma?
No.
Okay, have you ever had any seizures?
Nope.
Okay, great. So first I'll start with your head. I'll inspect your scalp, your hair, and your skull. Take a look at everything. Perfect, everything looks great. Next we'll move on to your face. I don't see any abnormalities. So can you please smile, show me your teeth, can you puff your cheeks, can you frown and raise your eyebrows? Okay, great. Can you please clench your teeth? Let me know when you can feel this.
I can feel that. And I can feel that.
Okay, great. Next I will check your sinuses. My hands are clean. Okay, great. And then I'll check your TMJ. Can you please open and close your mouth? Okay, perfect. And then I will check your temporal artery. Great, okay. Next we'll move on to your neck. Have you had any painful swallowing recently?
No.
Any pain or tenderness in the neck?
No.
Okay, great. I'll inspect. Everything looks great. I'm going to palpate your trachea. Okay, everything feels great there. Okay, next, can you please move your head up and down? Can you rotate it to the left and to the right? Okay, great. Can you touch your ear to each shoulder? Okay, can you shrug your shoulders for me? Perfect. Okay, you can lower them. Okay, don't let me push your head. Great. Great. Okay, can you shrug your shoulders? Don't let me push down on them. Okay, perfect. Okay. Next, what I'm going to do is I'm going to check your nose. Okay, that's great. Now I will listen to your carotid artery. Okay, everything sounds great. Perfect. Next we'll move on to your ears. Have you had any recent hearing loss? Any drainage from the ears?
No.
Okay, great. Okay, looks great. Now we'll move on to the nose. Have you had any sinus problems recently?
No.
No? Any trouble breathing?
No.
Perfect. Okay. Can you please tilt your head back for me? Great, okay. Can you please close one nostril? Inhale. Okay, other nostril. Inhale. Perfect. Okay, can you close your eyes for me? Let me know if you can smell this.
Yep.
Okay, perfect. Okay. Next we'll move on to your mouth. Have you had any pain with your teeth or your mouth?
No.
Okay, when was your last dental exam?
3 months ago.
Okay, perfect. So if you can open up for me. Great. Okay. Put this in. Okay, can you say ah? Okay, great. Now normally I would palpate your gums and the inside of your cheeks. Since I don't have gloves on, I'm just going to inspect them. Everything looks great. Okay. Next, we'll move on to the eyes. Have you had any recent problems, any eye problems, any problems with vision?
Nope.
Do you have a history of glaucoma?
Nope.
Do you wear contacts or glasses?
Yes, I do.
You do? Okay. Perfect. So first I'll start by inspecting them. Okay. Everything looks great. Next, if you could focus your eye right here on the tip of my pen. Okay, perfect. And then follow this as it comes to your nose. Okay, great. So next I'm going to shine this right on the tip of your nose. You can just look straight ahead at me. Perfect. Okay. And then what I'm going to do is I'm going to shine this in each one of your eyes. It'll be bright for a few seconds, but I'm just going to check your pupillary reflex. Okay, perfect. Next, we're going to move on to your chest. Have you had any trouble breathing recently? Any chest pain?
Nope.
Fatigue?
Nope.
Okay. Okay, so I'll inspect your back. Everything looks great. I'll check rate, rhythm, and depth of your breathing. That looks normal as well. Now I will move on to chest expansion and excursion. So if you can breathe in for me. And out. Perfect. Great. Okay. Now I'm going to palpate right here. Okay, great. I'm going to press. Okay. Next, I'm going to listen to your back. If you would, take a full breath with each spot. Okay, great. Now if you can spin back around for me. Okay. Now I'm going to take a listen to the front of your chest. Can you breathe in for me? Okay, great. Okay. Next I'll check skin turgor. Okay. I'll check for hues and thrills. If you can you take a deep breath for me? Okay. And one more time. Okay. Perfect. And when was the last time that you had a breast exam?
About a week ago.
Okay, do you know how to perform self-breast exams?
Yes.
Okay, awesome. Okay. Okay. Next, we'll move on to the cardiac assessment. Have you had any chest pain recently?
No.
Any history with hypertension?
No.
Okay, perfect. So what I'm going to do is I'm going to go through and listen to each of the sides on your chest. Okay, and can you lean forward for me? Okay, great. Perfect. Okay. Now I will move on to your pulses. So if you can, take this, and I'll check your upper extremity pulses. Great. Perfect. Okay, perfect. Okay. Check your capillary refill in your nail beds. Okay, perfect. Okay. Next, I will check your lower extremity pulses. So I will check the femoral pulse as well, but then I will move to the popliteal pulse. Okay. The posterior tibialis pulse. Okay. And the dorsalis pedis pulse. Okay. And then also check for Babinski. Okay, perfect. Perfect. And then I'll also check the nail beds and capillary refill in the toes. Perfect, thank you. Next, we will assess your abdomen. Have you had any pain in your abdomen recently?
No.
Okay, when was your last bowel movement?
This morning.
Okay, perfect. If you wouldn't mind, could you please do that for me? Thank you. Okay, and then I would inspect the abdomen for any pulsations, make sure everything looked uniform, check for scars, and also check for tone. Everything looks great. Now I will auscultate. I'm going to auscultate each of the 4 quadrants of the bowel. Okay, and I'm also going to auscultate the aorta with the bell. Perfect, thank you. Now I'm going to percuss. Okay. And then lastly, I'll palpate. Let me know if you have any pain when I palpate. Okay, perfect. Then I would also assess and inspect the bladder. Everything looks great with that. And then for the genitourinary exam for a female, She would be in the lithotomy position for the assessment and the inspection. And then next we'll move on to the musculoskeletal assessment. Have you had any broken bones or pain in your joints recently?
No.
Okay, do you have a history of broken bones?
No.
Okay, perfect. And do you ever fall or lose your balance?
No.
Okay. So now we'll assess and palpate the upper extremities. Okay. Everything feels normal there. Okay. If you don't mind, could you hold your hands up like this? Could you pull towards me? Perfect. Push. Awesome. Do it one more time. Push. Great, thank you. Okay. Can you squeeze my hands? Perfect. And can you splay your fingers? Perfect. Okay. Can you lay back down for me? Now I will palpate the lower extremities. Perfect. Okay. Can you lift your leg up? Pull down. Lift your leg up. Pull down. Perfect. Lift your leg up. Pull down. Lift your leg up. Pull down. Perfect. And now I'll check your feet. Okay. Can you pull back towards me? Perfect. Can you push into me? Perfect. Thank you. Okay, so the next step in the head to toe assessment will be a neurologic assessment. Have you had any recent neurologic changes?
No.
Okay, have you had any problems with coordination?
No.
Okay, perfect. So what I'm going to do is I'm going to hold my finger out, and if you would, please touch your nose and then touch my finger. Okay, continue to do it. Okay, great. And the next what I need you to do is, can you stand up for me? Okay. And if you would, can you take your heel and can you run it down your shin for me? Okay, other side. Okay, perfect. And then next what I'm going to do is I'm going to touch your legs, and then can you tell me which leg that you feel the pressure on?
Both. Left, right.
Perfect. Okay. Next what I'll do is I'll assess your posture. Everything looks great. And if you can turn to the side for me. Turn this way. Okay. And if you can bend over. I will check your spine. Okay. Great. Everything looks great with that. And then next what I'll do is the Romberg test. So if you can stand still for me, okay? And if you can close your eyes, open them, close your eyes, then open them again. Great. And then I will assess your gait. If you could please walk down and back for me. Perfect. Okay. Pull the chair back in. Okay. And the last step in the head to toe assessment will be checking your reflexes. Have you had any spasms recently? Any bad spasms? Okay. Any pain in your muscles or joints?
Nope.
Okay, perfect. So I'm going to use this as my makeshift reflex hammer for today. So first what I'm going to do is I'm going to check the bicep. Perfect. Perfect. And then I will check the triceps. Thank you. Last. Okay, great. And brachioradialis. Okay. I'll check the patellar. Can you try to lift your leg up for me? I'll go ahead and restart that. Next, we're on patellar. And then onto Achilles. Sorry, I know it's hard to see. Okay. And then finally, the Babinski. Great, thank you. Alrighty, and that is now the end of your head-to-toe assessment. Thank you.
Thank you.